My name is Caitlin Collins, and I'm an assistant professor in the Department of General Surgery. I am a trauma surgeon and surgical intensivist. I think the thing that I appreciate most about my job are some of the unique circumstances that are inherent to my specific job, and that most people don't wake up in the morning and say, I know what I'm going to do with my morning. I'm going to spend it at San Francisco General Hospital with a bunch of strangers who I've never met before. Um, Especially for trauma surgeons, a lot of the circumstances that brought them to the hospital and in front of me were largely entirely out of their control. And then when they come through the doors of the hospital, a lot of what happens to them is also entirely out of their control, including the surgeon that happens to be staffing the hospital at that time. And so I think that their initial injury and their first experiences with healthcare that day involve a huge loss of agency. And then once the dust settles, we're trying to rebuild a relationship, a functional patient-doctor relationship with these people that involves trust, that involves helping them regain a sense of agency in that process. And I think that there's just something incredibly raw and incredibly human about that experience that is a privilege for us to be able to witness and hold space in those moments with people. San Francisco General Hospital, where I do most of my service, is the safety net hospital for San Francisco. It's the county hospital for the city and county of San Francisco. And it's also the only level 1 trauma center in the city and county of San Francisco. Which means that because of the socioeconomic and political factors that drive a traumatic injury, we are often taking care of vulnerable populations, people coming from vulnerable populations and underserved communities. I've always been interested in health equity and social justice as it relates to healthcare. So I feel like the setting in which I have chosen to practice medicine is particularly relevant. I think that being able to provide the best possible care for these patients is my way of trying to bring access and health equity and social justice to the trauma division at San Francisco General Hospital and to the patients that I serve, the community that I serve. As a trauma surgeon and an intensivist, some of the things that we see are pretty rough, are really intense. And I think that the moral distress that would cause for me would be intense if I weren't also doing something to help curb some of the upstream factors that landed that person at my doorstep or the doorstep of San Francisco General Hospital in the first place. So our first touch point with them at the Wraparound Project is really after they've suffered an intentional violent injury. But in terms of where I think the future lies, it's going to be in driving and helping to drive a lot of the policies that contribute to violent injury, a lot of the social determinants of health that contribute to violent injury, and moving towards the complete prevention rather than the secondary prevention that we currently focus on. I'm incredibly humbled to be named a John A. Watson Scholar, and even to carry, John Watson's legacy forward into the future.